Diagnosing Meralgia Paresthetica is typically straightforward and based on the clinical presentation. There's usually no need for imaging or extensive testing. The hallmark signs are the localized pain and paresthesia in the lateral thigh without any motor weakness. Fortunately, this condition is often benign and self-limiting. For pregnant women, the symptoms usually resolve postpartum as the abdominal pressure decreases. The mainstay of treatment is conservative management. Avoiding tight garments and focusing on weight loss can significantly help reduce symptoms. For those needing additional relief, non-opioid analgesics like NSAIDs are often effective. In more persistent cases, anticonvulsants such as gabapentin can be used, and if symptoms remain refractory, options like nerve blocks or even surgical release might be considered. Continuing with our discussion, let's now explore how to differentiate Meralgia Paresthetica from other causes of leg pain. For instance, greater trochanteric pain syndrome or trochanteric bursitis typically presents with sharp pain confined to the trochanteric region. This pain worsens with ambulation or lying on the affected side, and unlike Meralgia Paresthetica, sensation isn't affected. Similarly, sciatica, caused by compression of the sciatic nerve or contributing nerve roots, manifests as back and buttock pain radiating down the posterior thigh to the foot. This is often accompanied by lower extremity weakness and a positive straight leg raise test. Another condition to consider is spinal stenosis, usually seen in patients over 60 due to degenerative arthritis. The pain in spinal stenosis is felt in the posterior thigh and often radiates to the distal lower extremity. It typically worsens when the spine is extended and is relieved with spine flexion. Shingles, although less common in pregnancy, can cause pain and paresthesia in a dermatomal distribution and is usually associated with a vesicular rash. And let's not forget about the round ligament pain in pregnancy, which is due to the stretching of the round ligament by the enlarging gravid uterus. This pain, however, is typically located in the lower abdomen and ipsilateral labia and doesn't involve sensory changes. To illustrate this, let's consider a real-life case. Emily, a 34-year-old woman in her third trimester of pregnancy, began experiencing a burning sensation and numbness in her right outer thigh. The pain intensified when she stood for extended periods or extended her hip. Worried, she visited her healthcare provider, who, after a thorough examination and history taking, diagnosed her with Meralgia Paresthetica. Her provider reassured her that this was a benign condition and advised her to avoid tight clothing and to rest frequently. Emily also started taking NSAIDs for pain relief. Postpartum, her symptoms gradually resolved and she could return to her usual activities without discomfort. So that's Meralgia Paresthetica, a condition that, while uncomfortable, is typically manageable with conservative measures and often resolves on its own, especially in the context of pregnancy. Thanks for tuning in to this episode of Med Madness podcast. Stay healthy and informed, and we'll catch you next time.